Welcome to the Getting Down with Digital Health podcast, sponsored by Mend. We hope to inform and inspire you on a wide variety of healthcare topics. We're grateful you're joining us today. And now, on with the show.
What up, everybody, and welcome to another episode of Getting Down with Digital Health. I'm your host, Brandon Worley, and joining me today, as always, is my fellow co-founder and CEO of Mend, Matt McBride. Matt, what's up, man? How you doing?
Doing great. Your intro just always, gets everybody excited. So,
just trying to raise the roof, man, and keep people engaged. So, Matt and I are very excited today because we have a special guest. Dr. Aragam is here with us. She is a psychiatrist at UCSF. Dr. Aragam, welcome. So happy to have you on the show with us today.
Hi, good to be here. And thanks for that very energetic intro. That was wonderful. I'm so awake now. This is great.
Right. I achieved my mission. So Dr. Aragam, for the audience, if you wouldn't mind, please just introduce yourself and let them know a little bit about your background.
Well, thanks for having me. My name is Gowri Aragam. I'm an adult psychiatrist, currently assistant professor at psychiatry at UCSF, previously at MGH, where I did my training. Just finished up a fellowship at UCSF as well. My past or my my career has been also co-founder of Stanford Brainstorm, which was the first kind of academic lab for mental health innovation, where we taught a course on mental health innovation. We kind of wrote papers. We consulted with tech companies. We were advising startups, kind of doing everything we could to really build an ecosystem and kind of bring together the big gap we saw between industry innovators and kind of academics and clinicians who are kind of really understood the space. And so that's kind of been my passion. I try to do that however I can, bridging those gaps. And yeah, I think that's the brief version. How was that for an intro?
No, that was awesome. And your background, I know when we first learned about you and your background, that was what was so intriguing to us, is not only are you, a psychiatrist and practicing and helping care for patients, but you have such a deep tech background and a passion for it. And I think, the folks who will be viewing this, I think could get a lot of value out of your insights, because as you know, digital health is just moving so fast now in all of healthcare, but especially in the mental health space. So since you do have that unique background as both a psychiatrist and involved in tech as a consultant and in other areas, what are you currently working on?
I can't say too much about what I'm currently working on, but I can tell you a range of things that I've been working on just to kind of keep it. But generally speaking, I would say I've historically at least worked on either kind of co-developing kind of tech-enabled products that companies want to use either for direct healthcare delivery or for kind of general public health education. Or I've also worked more recently on really kind of nitty-gritty stuff, like figuring out how to best onboard new clinicians to a web-based digital health platform, both in terms of using the interface, making kind of EMRs more kind of user-friendly and useful clinically, and also making it easier to onboard people kind of maybe less, and to provide kind of training modules and resource guides. Because as you know, there's just been a huge explosion of healthcare delivery platforms and trying to get new providers to be able to deliver those services. So kind of how helping kind of figure out how to maintain quality as that happens. That's kind of been more recently what I've been working on, which I think is, more nitty gritty, but very much necessary. But yeah, that's kind of like a general sense of the general categories of things that I've been involved with.
In all of that work you're doing, which sounds very exciting, and on behalf of all of us who are trying to move the digital health utilization, across more providers, thank you for your efforts. Are there any specific trends that are really sticking out to you that you're noticing?
It's funny because I think the idea of trend feels interesting because I've been kind of in this space for about a decade, more intensely for the past 6 years, 7 years. And I think things that I've noticed over that course of time continue to be similar, but there's just more evolutions. The things are getting kind of more evolved, I would say, in terms of their ability to kind of deliver on the promise. What I've been noticing, there's definitely a push more recently towards kind of youth mental health, which has always been important, always been the thing. But I think more recently, it's a lot more money and time and effort being kind of put into delivering services that are specific for kind of the youth, and kind of seeing them as a demographic that requires a particular kind of intervention and approach, which I think is really great. And that's from gaming, from all the way from like gaming to kind of direct online healthcare services to kind of the in-between time, and really understanding kind of what their day-to-day looks like. I think that kind of quickly goes on to another thing I've noticed, which is just this idea of well-rounded services. So I've noticed these kind of platforms that used to maybe do just therapy or just psychiatry or just education, really trying to kind of expand and sort of combine modalities. So they're able to provide something for each person that comes into their ecosystem. It's like one person might need therapy, one person might need psychiatry, one person might need coaching, one person might just need some digital tools to kind of help them re-up on their skill building, right? So I think I've noticed kind of an expansion of these ecosystems within just a particular company. And so noticing a lot of companies that are merging, companies that are being bought out to really kind of facilitate expansion, which I think allows for easier movement for patients, ideally in the future. It makes that care model a bit more seamless. Is I think the ideal is what people are really looking for. It's like, how do you make people not have to leave and then be kind of lost to the wilderness again? And how do you help them kind of stay within and have whatever they need within the service platform? If that makes sense. I keep going. I have two more that I had in mind, but
please keep going.
Another thing I've noticed is sensors have been around forever, right? I think we've all been really interested in sensor technology, and it's something that kind of, for me, came to my attention specifically in mental health as it pertains to autism and kind of skin sensors. So I think that, to me now, fast forward many years, and I think there continues to be a push in the sensor world as it pertains to mental health. And I think, again, that goes from things like heart rate variability and trying to make that a sensor that is a lot more portable. I think that people can measure more frequently, because we're realizing how much that correlates with, anxiety, stress, depression, and then kind of chronic medical illness, all the way to just, people being able to understand to skin sensors again, right? Like this idea of how can we measure or sleep sensors, right? It's like, how can we measure the depth of our sleep? So I think there's going to be there continues to be a push towards that. And again, like vocal sensing, right? So it's like, how do you, and by sensing that's more kind of vocal, like technology to understand the vocalizations and like different elements of a vocal tone, frequency, speed, variability, to understand how that correlates with kind of mental illness states.
Let me ask you about this heart rate variability, because I mean, mine is usually, between like 40 and 50. So I've got a sensor. I can track it just more from a fitness perspective. But how does that correlate? How does heart rate variability provide an indication of how somebody's doing?
The quickest way I'll put it, for the sake of time, is that I think heart rate variability, they think, has been found to be kind of a correlate to kind of vagal tone, which is parasympathetic tone. So essentially how good your body is at kind of getting to a kind of calmer rest digest state. So if anxiety and stress kind of activates your sympathetic system, to put it simply, then that usually leads, then your parasympathetic system kind of helps with kind of calming one down, right? And kind of dealing with that stress. So you're not putting your whole body in that stressful state kind of chronically. And so the vagus nerve is like kind of the primary nerve associated with that parasympathetic system, and heart rate variability is something that is controlled by the vagus, because it has to do with kind of our breathing, how much oxygen versus carbon dioxide we have in our bodies, how well we can deal with that, and how much our heart has to kind of pump to sort of bring us back to like an equilibrium state. So long story short, is heart rate variability is kind of is a proxy for vagal tone, which in vagal tone is a measure of how well our kind of parasympathetic system is working to help us kind of stay calm. So it can change throughout the day, and people who have high or low ones, you can kind of tell whether or not they're kind of chronically at risk of high stress or not. And it's cool because we can measure that now, and it's something that people have used, but it's very cumbersome in the past to measure that and really help people in therapy kind of manage their HRV, heart rate variability. But it's a huge, could potentially be a really huge way forward in helping people deal with trauma, with stress, anxiety, all that.
And I think there's, reliable sensors now, and accurate sensors. So that's interesting. So patient prescribed a device, or maybe they have to get their own device, or is this something that, is emerging, and that all that stuff is still being worked on?
Right now, sensors, I mean, I can't speak to everything, so I'll tell you kind of what I've noticed, but I think right now, like what we're seeing, I mean, there's a general commercial trend towards sensors, I think, right? So like a very kind of direct to consumer model. I think ideally, the goal is for people to be able to get this in the hands of patients, which is, I think, the goal in general, right? Is to how do we actually help people who need the help? And so I don't see, physicians prescribing sensors by any means, unless they're, I think there's some more cutting edge ones who might and who may have the capability to do that in their practices for sure. So I don't want to knock, I'm not going to speak for everybody, but I wouldn't say it's kind of widely available yet, because I don't think people really know what to do with the data, right? It's like, this is still kind of up and coming. This is something that's relatively new, something, what do you do with that data? Which is, I think, is a big question that we're probably going to talk about probably soon in this particular podcast episode and conversation, but also in general. It's like, what does one do with the data, and how do you use that to kind of help the person sitting in front of you?
We'll touch on it a little bit more in some later questions, because I've seen it captured through a web camera, which is pretty amazing. And so, I've got the sensor. I can access my heart rate variability, and then I can run a test through my web camera at any time and kind of see. It's pretty darn accurate. So, I think there's a lot of cool things like that emerging that we'll see in the not too distant future.
Yeah, for sure.
Yeah, and that was a great answer that you gave around the sensors. And I know I learned a little bit there. So thank you for that.
Yeah, of course.
So clearly you have a passion for digital mental health, right? And that encompasses a lot of different things, part of which you just elaborated on, and some a little bit earlier when you were talking about, some of the trends you're seeing and some of the things that you're working on. But I'm going to venture to say there's going to be a good part of the audience who will be viewing this who may not have in-depth knowledge of what digital mental health means. So if you wouldn't mind, for their benefit, could you just define what digital mental health means to you?
That's actually, thank you for saying what it means to me, because I don't want to be butchering this and having someone like, that's not what it is. No, I mean, this is so funny that you asked this question, because I think my team over the course of many years were like, what are we defining this as, right? And I think, over the course of time, it's become, to me at least, to be, and I think in general, to be like services and tools one can use on any kind of mobile or web-based platform. And that includes, so kind of these, if you can get services kind of using your phone, an app on your phone, on your computer, through a website, and that includes wearables and sensors that usually have some kind of mobile or web-based platform that you use to kind of hold their data, make sense of the data for you to have, there's some kind of dashboard for you to kind of see what's going on. So I would say it's sort of, I kind of simplify it in that way. It's like, that's kind of how I would most easily define kind of digital mental health, to me at least. But I think that encompasses a lot of stuff and a lot of what we see out there in terms of these companies. And so does that kind of align with how y'all have been thinking about it, or how have you defined it for yourselves?
Here's how I like to think about it. Mental health is really one of the sort of one of these specialties that can almost, can have some sort of digital component every step of the way. I mean, you could get all your treatment, virtually, whether it's some intensive outpatient therapy, you're seeing your psychiatrist, you're getting your therapy, or, there's even clinical assessments. There's other types of tools and therapies that seem to be done virtually. So I like to think of it as that mental health organizations are really sort of leading the digital revolution. And I think showing a lot of other specialties and just showing healthcare what can be done, because you could receive care almost 100% remotely. So I think there's a lot of other aspects to it, but I think I just like to think of, I think mental health is really almost defining what digital health can be.
Can be. Yeah, to your point, right? I think you kind of start with like you're talking now about like what does it look like to apply those mobile and web-based tools, which is there's like a whole arc of care that you're referring to, I think, right, Matt, in terms of identifying who needs help, making the assessment of said person, following them through, kind of making treatment decisions along the way, making sure they stay engaged all the way through to kind of them experiencing some relief. And then all the interstitial stuff in between, right? All the communication that happens, all the, like pharmacy visits that happen, all of the the medication adhere, like the medications and treatment plans that they have to adhere to. Like, how do you kind of ensure that they kind of stay on path? And what does that look like? Which I think leads me to actually, I'm going to go back for a moment. You mentioned what else I'm seeing in terms of trends. I think this is not as much a trend as it is this is not as much a trend as it is a mandate, but I've also been seeing a lot more, at least conversation, which is great, around how to do what you just described, Matt, in a way that's actually culturally kind of sensitive and that actually accounts for a person's background, their ethnicity, just where they live. Just how do you incorporate this idea of making sure something is culturally accessible to someone? Because mental health, is so intertwined with kind of our daily life, right? Like our social lives, our occupational lives, just the fabric of how we go about our day. And that inherently is so entrenched in kind of the cultures that we inhabit and that we live in as well. And so I think that's another trend. But to your point, digital mental health is just, I think it is a way to use those kinds of technologies to facilitate that entire arc of care. And then ideally actually create new pockets of care and allow a person's life in between visits to also be really meaningful and provide a lot of benefit to them. As opposed to right now, which is kind of like, visit, or what had been the case, right? Which is visit, and then dead time kind of in between.
You mentioned this, almost tailoring care to a given culture. Is there an example of that you could maybe describe to the audience and maybe how it made an impact? I haven't really necessarily heard of that before, so wondering if you could elaborate on that a little bit.
In terms of an example, I can give you an ideal example, I think, in terms of what people are working towards and how little things have already made a big difference. I'll give you a small example, which is not exactly what I had in mind when I said it, but I'll give it anyways, because it counts. For example, in the emergency room that I worked in, right? It is a county hospital in a part of California where there's a very diverse kind of patient population within the catchment area of that hospital. And a huge barrier to care for them had been that they just did not have adequate interpreter services, and from Spanish through ASL, right? And using sign language. And so I think being able to provide them with the hardware, which was the phone and the video monitor, and then the software, which was the people, not the software, I guess the service, which is the people at the other end of the line, was a huge win because we were able to provide interpreter services for people coming in with even languages that were less common in the area, right? And so I think that was a huge win in terms of being able to provide services in a way that you could tell it made people feel more at ease. You could tell they were able to speak more openly and were able to actually figure out what was going on. And the sad part is, prior to that, I hate to say it, but there would be a lot of assumptions being made, which still are made, to be fair, to be honest, but even more so. And, a person's inability to communicate in English, for example, would be somehow pathologized in a way that was just really, really, really unfortunate and wrong. And so now being able to actually communicate with someone in their native language in an effective and like seamless way was a huge win. You take that as a small example, but also with big impact, right? Of the impact technology in general can have on kind of culturally sensitive care. And then you kind of, what I was talking about also is that is now expanding, right? It's like, how do you kind of both literally and figuratively speak the language that a person is used to speaking? in a way that makes them feel more at ease, the way my patients felt more at ease sitting in the chair, being able to share more openly, and feel like they identified with someone in the room or something in the room, which in this case was a voice. And you're seeing kind of more and more kind of platforms coming out with, and one of the first things I thought was kind of meditation content. Meditation's a inherently non-Western kind of tradition. How do you really kind of acknowledge that and decolonize that space and provide options for meditative audio, for example, that call upon various cultures and various religions and with different voices, right? Sharing them. I think that was one of the first things I saw to really kind of speak to particular cultures. I've also seen kind of ways that people are kind of providing, there's different ways that mental health issues can show up depending on one's background. And so getting more of a sense, not making assumptions about how that might happen, allows you to, one, provide educational content, but also to ask questions you may not otherwise ask, show certain images you may not otherwise show. I think it's in order to sort of like build that client and patient rapport. And so while that doesn't mean like totally changing the book in terms of what the tools look like, on the back end, it does mean that you are tailoring the design of said tool to make it feel more comfortable for the person using it, much in the way that interpreter service might, interpret English into whatever language it is that person actually does speak, right? And so, does that kind of resonate with you, or does that kind of make sense at all? I know I was there.
Absolutely, because we support 8 different languages today. So some of the most common languages. This is just our notifications, our text messages, our digital forms, our website, and so we've seen customers that will have high populations of certain folks, like, Haitian Creole is one, for example, that we've got everything in that language, from the notifications, the website, the forms. In that instance, there's such a population, they may have providers that speak that language, but we've got the ability through telehealth to bring in, and connect up any translation service. So I definitely think that has been a big one. And if you're trying to, get mental health help, and there's a massive communication barrier, massive language barrier. I mean, I think that it doesn't help, right? It just adds to the frustration. So we've definitely, seen that, and being able to support multiple languages is something we've taken pretty seriously.
And the only thing I would add to that too is kind of an end result of all of these really nice features that these digital health companies have put together is, we very commonly see new groups that we partner with going from 40, 50, 60+% no-show rates with in-person visits to single-digit no-show rates. So what does that mean, right? It really means that patients who are seeking care through digital means are getting the care they need more frequently than if they were just going in the traditional in-person setting. So hopefully that will lead to better outcomes and people just, continuing on their journey to wellness, even faster. So tons of help that you see from it.
Yeah, no, absolutely. I think that's the power of that. I mean, so sometimes even the small tweaks can lead to such a big impact, right? We can't underestimate how nervous one feels, including us, right? When approaching something or trying to engage in something that's meant to help us, but is also can be very intimidating and doesn't always treat us with care or kindness, right? And so if you kind of add on to that, all these things that we've been talking about, I mean, it's not surprising to me the no-show rate is that high. And so I think what I always talk about is when people are kind of thinking about how to innovate in this space, I might be preaching to the choir here, and I don't even mean to be preaching. I just want to just say it because it's pretty practical. It's like, to Matt's earlier point, I mean, mental health and what we were talking about earlier, mental health it's within the fabric of our lives, right? It's our emotional states. It's how we interact with ourselves and how we interact with other people and how we make sense of the world. That is a constant in our lives, like every moment of the day. And so I think it inherently is going to intermingle and coincide, intersect with just the basic like needs that we have each day, and the base, and a lot of these administrative issues that come up, whether it's signing forms, having to physically get somewhere, having to get childcare for your kids, have just these things that seem so simple, but are actually can be very, very difficult. Making those things more seamless is inherently, I think, improving the well-being of a person and or family unit, right? Because one, you're facilitating this, what you think is a small deal was actually a huge obstacle for this person or family. And it ends up facilitating their kind of ongoing continuous care. And we've noticed that with mental health, right? Sometimes just even seeing the person and having a touch point frequently can be enough for certain people, right? To just have that person to go to on a consistent basis can be therapeutic in and of itself. And so just the additive effect here and the cumulative effect, compound effect of being able to facilitate a lot of these interstitial things for these people and family, I think is not talked about, is sometimes underestimated and not kind of, I think, talked about enough. I know that's what y'all are working on at Mend. And so that's kind of why I bring it up, because it can have a really huge impact.
Well, just to switch gears a little bit from maybe the patient side to the provider side, because I think, you know, our audience is going to be a lot of decision makers in healthcare, and that's kind of who we send the episodes out to. And so, you know, I had saw the podcast that you were featured on with on the Psych Congress Network with Dr. Chan, and you were discussing this need for support around digital tools. And you know, my curiosity lies, we've always tried to provide a lot of customer service and support. And so, you know, for patients it's a little bit easier. Providers don't always have time to really work with anybody on the support side. They're so busy. So I was kind of curious, is this more like, what kind of support do you think is needed and lacking? What would you communicate to the decision makers out there on the support that's needed around these digital tools?
Oh gosh, it's a big question. There's a lot of different ways this answer could go. My team at Stanford, we had done last year a survey during COVID of practitioners that was recently published. And we asked them a lot about, you know, it was kind of attitudes towards technology and practice. And, you know, asked them a lot about, you know, what was that allowed them to kind of take on telemedicine so quickly during COVID, right? Obviously, there was an imperative to do so, but what else did their administrations do to facilitate that? It was kind of one of the genre of questions that we'd asked. And if that same kind of support could translate to other digital tools, and if they had that same kind of support, would they be open to using digital tools in their practice, right? And what we found was that, which I guess is not so surprising, so just more fun to get it through a survey than not, is that most of the people that we have either spoken to or who took the survey were just overwhelmed by how helpful it was to have like various layers of support from their institution, whether from the nitty-gritty of like, literally, how do I use this? Where is the customer support for the technology in and of itself? To like the bigger picture, like, am I covered? Like, is this legal? Like, am I allowed to do this? What am I, you know, like the medical legal aspects of things, and making sure they were covered from that front, right? It was kind of ran the gamut in terms of how they felt supported. That was, I mean, I think hugely, hugely helpful in how quickly people are able to kind of take this on during the pandemic and then ongoing. And I think policy-wise, there obviously were leniencies, right, in terms of out of state and, you know, who you could see and when you could see them and what you could prescribe and all of that. And so I think policy-wise, that kind of facilitated telemedicine adoption during COVID. And I mentioned this because I think we can learn a lot from that as it pertains to now moving forward and be like, how can we now, you know, incorporate digital tools that we feel like could be helpful? And I think one of the things I would say is, hey, you know, there's a huge array of tools that are meant to exist within healthcare systems and some that are meant to exist or designed to exist outside of it, right? And so let's think about like, what are the tools that actually exist now and that people want to incorporate into the medical system? And what kinds of tools are appropriate for a hospital versus a clinic versus group practice versus a purely virtual practice, right? There's various types of provider spaces that exist. And I think it's important to kind of consider what types of technology could be useful for each, because, in the same way, because look at anything else, right? Anything else that you would say, hey, let's kind of figure out what's going to be the most useful in this particular environment. And so I say all of that to for one reason, which is that I think we got to know, like, one, what people actually need, two, how to best support them from a systems perspective and being able to incorporate those things, and how to make sure they feel safe using whatever it is that they're using, not only from like a medical legal perspective, but also how do they know that's going to work for their patient's not at risk. Because I think that is a huge concern that goes through the minds of any physician or any provider, any clinician, which is like, is this thing I'm using going to help this person or harm them, right, that I'm with? And it becomes a huge struggle. And so any technology that's being incorporated, one, I think people want to use it. They want options for their patients. They want to be able to kind of give them something to use. And they want to, in the time that they don't see them, they want to make sure they come back. They want to see successful outcomes. And I think people are realizing that tech can really enable that. But it can feel like such a huge beast and a huge monster of like, I don't know, there's so many tools, but actually only a few of those tools are really relevant to your practice, to your patient population in this particular slice of time. There might be more coming down the pipeline, but like, let's not, get too nervous about those just yet. If you're in practice, like, sometimes starting small is really the way to go. And so before I keep going, does that kind of resonate with y'all in terms of what I'm getting at there? Or anything I should clarify or try and say again?
No, I think that's helpful. I think, from our perspective, we might think of support as like tech support, but then you were mentioning some of the other sort of legal and compliance support, because, the pandemic changes everything. Maybe you weren't doing a lot of virtual. Now all of a sudden you're doing all these virtual visits, and somebody is going to be seen and they're driving their car, or they're in the supermarket now. And like, there's sort of a whole different world of scenarios. And, well, what about HIPAA? And, is that, so we've definitely encountered a lot of those different things. And even just the prescribing of controlled substances was something that state laws dictated. That's the message to leadership here. There has to be, of course, the technical support available, or the training, and then, the legal compliance, maybe clinical support, even to make sure that people are doing things, according to the law and that's safe and going to be effective. So no, that makes a lot of sense.
Yeah. It's like, who can this be useful for? Right. It's like, I think being able to triage, we triage services all the time. Like, how do you triage tech in some ways? Because not everything is for everybody. And we know that already from other kinds of healthcare. And the same applies, I think, to technology.
So I'd love to kind of move in a slightly different direction and really learn a little bit more about your experience doing virtual health. If you wouldn't mind, talk a little bit about, how much virtual health you were doing pre-pandemic, then during pandemic, and kind of how that has evolved into the current state.
I did no virtual health before the pandemic. I had colleagues who were kind of filling in and trying to provide services to more rural areas. In emergency rooms primarily, or inpatient hospitals. But I myself was not doing any. I thought they were amazing. I was like, oh my goodness, how cool they can do this. During the pandemic, I was actually working primarily in an emergency room. So I was not virtual at all. I was fully in person for that. And then when I switched over to UCSF, I was doing inpatient work. So that was not virtual because I was doing consultations. But all of my outpatient work was virtual. So it was 100% virtual in the outpatient world. And now I think, it's 2022, there has been a push to kind of go towards more of a hybrid model. So kind of some outpatient, some inpatient, and really pushing towards getting people, some virtual, some not, right? And now really pushing to get people back into the clinic if they are able and willing to do so.
Have you had mentioned earlier about gathering some survey information, but have you gathered any survey information or even just general feedback from your patients about their view of virtual care and how it may be different than in-person visits?
Yeah, I think I've asked every single patient of mine kind of how they feel about this, just because I was just curious. I was working with a population that was kind of, I guess, all adults. So, and a range of ages. And for me, at least, every single person that I spoke to, and again, I'm not providing therapy, right? I was providing psychiatric service. So this does not, I would not say I would apply this to therapy, but in psychiatric services, that I was doing, I think all of the patients were very okay with being virtual, primarily because the way that the system worked was that a lot of them lived very, very far away. A lot of them required assisted kind of transportation to get in. It was more of a risk for some of them to actually come in than it was for them to stay at home because, risk of a fall or medical complication in transit was, non-zero, insignificant. So for many of my patients, they actually were very okay with it. On the other end of things, people with kind of who were in their car, in class, like trying to make ends meet, who had children. I would see many patients when their children were there with them. A lot of these were kind of postpartum patients as well. And so I think for the postpartum crew, that was a whole other reason for why it was helpful for them to be virtual. It was easier for them to show up. So that was the general sense people had from, at least for psychiatric services. And it was resoundingly positive. I personally did not hear much on the negative side from my particular patient cohort and from my colleagues as well. There was some, but it was for the most part, on the patient side, positive.
So now to flip that, from the provider side of, just kind of the general feedback you got, do you feel, I guess, what kind of feedback did you get? And did you feel like, we heard a lot about burnout during COVID pandemic, just providers, really just, working their tails off to try to care for folks. Do you feel like virtual care has helped improve the potential for burnout? Has it kind of stayed the same, or do you feel like it's gotten worse? Or I guess what kind of impact do you feel virtual has had on people, their workload?
Yeah, I'll speak to kind of how I've seen it vary. I think I have seen some people who I think would have probably been those people doing virtual pre-pandemic and been very happy with it, continuing to be very happy with it and loving kind of what it gives them in terms of flexibility in their life and their location and all of that and above. So I think there are many I've just been like, yeah, this is great. I don't want to go back. I have no interest in doing in person. Like, I really enjoy this, and I'm able to see patients I would never be able to see because they live, who knows, so far away. Especially in California, right? It's like a big state. And then I see others who really miss it. They really miss seeing people in person. They miss kind of the jolt of whatever brought them to be in person, because it felt much more enriching and much more fulfilling, and it didn't feel as draining to be seeing someone in person and not kind of over the screen. And I can't tell you what it is about each person that made them, like one versus the other in this moment, but definitely saw that. And I think others who were noticing that as much as the patients enjoyed virtual, from the mental health perspective, there were still things that were being missed. You can only see someone's eyes up. It's kind of like when you talk to your grandma sometimes, or my aunts, like, I can't see their face because they don't know where to look at the screen. And as sweet and endearing as that is, from a clinical perspective, you can miss a lot of stuff. Or seeing somebody only over the phone because they don't feel comfortable using their computer. Voice can tell you a lot, but you're also missing so much by just the observation. The full mental status exam cannot happen when you're only seeing, one part of a person's body. So I think there are other providers who are noticing that, there could be a lot being lost clinically from not being able to actually see the person in person, at least, every few months, if not every single time. Right. And so, yeah, that's kind of, I think, from clinically speaking, kind of what I've been hearing from my colleagues and also kind of from myself.
Thank you.
Well, I think we've had a lot of great information so far, but now I think it's time to switch gears and maybe have a little fun. And, I get to put you both through an optical illusion and see how it goes. So I am going to, so this one is from the New York Post, and I'm going to show you, I'll bring up the screen sharing, and you're going to see a square move back and forth across the screen. And we want to know the color of the square as it moves across the screen. So these are always fun. The audience gets to play along and be tortured as well. So let's see, we'll give it a second. And then, all right, I'll play the video here a couple times and see what you think.
It changes.
Yeah, so you kind of have like this beige and this sort of teal, or Brandon, what do you think?
Yeah, I mean, to me, I've done a lot of these things now on all these podcasts, so I know there's generally something I'm missing, so I'm trying to outsmart it. So it looks like it's changing to me, but if I had to pick one color, then I would say it's the reddish color.
Oh, that's pretty good. Check this out. If you were to crop out the squares on the opposite ends, they're actually the same color.
Oh, cool.
And it's called chromatic induction effect.
Huh.
So it's a perceived color shift.
Mm.
I mean, I definitely saw it going like more reddish to bluish for sure. So
yeah, I mean, it looks like it's changing. There's no doubt. It looks like it's changing colors.
Definitely.
That's cool.
Crazy.
Well, Dr. Aragam, thank you so much for your time today. I know Matt and I have had, really enjoyed this conversation and definitely learned a lot. So for all of you watching, I hope you enjoyed this episode as much as we did. Please feel free to hit us up with any questions or comments you might have. In the next episode, we'll have another great digital health thought leader for you. Please make sure to like and subscribe. Thank you so much for watching. Again, Dr. Aragam, thank you very much on behalf of Matt and I and everyone at Mend and the entire audience. Have a great rest of your day.
Yeah, you too. Thank you both. Have a good one.
All right. Take care.
Thank you for watching today's episode from the Getting Down with Digital Health podcast. To learn more about Mend or to access more content, please visit mend.com.